Good, happy Wednesday morning, July 21, 2021. I'm Riley King, and welcome to this morning edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Wednesday morning, so let's get started right now. First up, New Hampshire surpasses 100,000 COVID-19 cases. Let's take a listen to that video from WMUR News 9.
Spend quality time this summer with family and friends in a relaxing and rejuvenating space where everyone can unwind.
New Hampshire hitting a grim milestone. 100,025 Granite Staters have contracted COVID-19.
It does just speak to the tremendous impact that this virus has had in our communities.
Dr. Beth Daly, chief of the Bureau of Infectious Disease Control, says cases in New Hampshire have increased slightly over the last 2 weeks.
This could be attributed to more people coming into contact with one another as they try to resume normal lives. It could also be being driven in part by the Delta variant.
So far, New Hampshire has confirmed only 21 cases of the Delta variant. Local doctors say it's likely contributing to an uptick in hospitalizations as well.
And the vast majority of new cases are in unvaccinated people when we come to hospitalizations.
Frustrating, says Dr. Michael Gilbert, Chief Medical Officer for Catholic Medical Center in Manchester.
It's hard to see people get sick enough to be hospitalized, and it's hard because almost all of these cases are preventable.
And with the potential for another surge in cases this fall, doctors are urging people who are eligible for a vaccine to get their shots.
The best thing that we can do to minimize that and allow people to continue to get back to normal is to get vaccinated.
These vaccines are still very effective against the variants, and so if you have concerns about getting a variant strain of COVID-19, the best way you can protect yourself is by getting vaccinated.
And state health officials say right now they don't plan on making any changes to COVID-19 protocols such as masks in public. They are, however, reminding people to take the usual precautions such as good hand hygiene and staying home when sick. Reporting live tonight, I'm Tim Callery, WMUR News 9.
Okay, and there you go on that video and that report. Business booming for lodging and rentals in Great North Woods. Let's take a listen to that video from WMUR News 9.
Spend quality time this summer with family and friends in a relaxing and rejuvenating space where everyone can
Some business owners in Coos County say this is turning into the bounce-back season they were hoping for.
We're actually doing phenomenal. I think that through COVID and everything, people have just been caged up. So they're looking to go to the Great North Woods.
The Buck Rub Pub and Lodge in Pittsburgh is seeing visitors from all over New England looking to escape and get outside.
We have ATV trails that come right to the Buck Rub Pub. Lots of hikers, fishermen, fly fisher.
And now, owner Jude Marquise is looking forward to even more business. Starting August 9th, fully vaccinated Americans will be able to cross the Canadian border.
We're really the gateway to the Canadian border in New Hampshire. So we're very excited for the borders to be open. And we know that passerbys will come in and have a great meal at the Buck Rub Pub and also probably on their return as well.
Canadians still won't be able to come into the U.S., but rental property owners think more Americans will be heading north next month.
While I believe that the Great North Woods in New Hampshire and the Northeast Kingdom have everything that people would need for recreation, outdoor recreation, they do use those properties as platforms to venture into Canada.
Michael Pacheco rents out several properties near the Canadian border and says summer has been booming for him as well.
We got a lot of New Hampshire business, a lot of New England business in general, but they came in droves.
Something to keep in mind if you are planning a trip to Canada, you'll need your vaccination card and be ready for random COVID testing. Mike Cronin, WMUR News 9.
Okay, and there you go on that video and that report. Dartmouth professor, former astronaut, weighs in on Blue Origin launch. Let's take a listen to that video from WMUR News 9.
My old roof was an asphalt roof. It was really starting to look ragged. It's an island house. I wanted it to blend in better, so I decided.
Blue Origin's New Shepard rocket launching from Texas, making history and paving a way for the future of space travel.
What we're doing is the first step of something big.
The rocket into lower orbit carrying Amazon founder Jeff Bezos and 3 other passengers inside that capsule at the top, traveling at more than 3 times the speed of sound, reaching space in just 3 minutes.
Oh, I love it!
82-year-old aviation pioneer Wally Funk making history as the oldest person in space. An 18-year-old paying passenger on board, now the youngest.
It's an exciting time for spaceflight.
While many watched the launch, few people have had the opportunity to know what it actually feels like to be the one going into orbit.
I was very fortunate to have the chance to go and fly in the space shuttle.
Jay Bucky spent time aboard the Space Shuttle Columbia in 1998 and is now director of the Space Medicine Innovations Lab at Dartmouth College. He calls this an exciting time for spaceflight.
It definitely seems like there's a possibility we're going to have more people up there, private space stations, a lot more going on in low Earth orbit. So I think that's pretty exciting. It's about time.
Today's quick flight into orbit on the aptly named New Shepard rocket, reminiscent of New Hampshire's own pioneering astronaut Alan Shepard.
As a matter of fact, Alan Shepard's flight was a suborbital flight just like the one we had today.
And Bucky says with ambitions in space, it paves the way to reach further for the stars.
As low Earth orbit becomes more of a commonplace commercial place to go, we still have these other new places that the government and other places are working on.
Charisse LeClaire, WMUR News.
Okay, and there you go on that video and that report. New Hampshire farmers struggle with unusual wet weather. Let's take a listen to that video from WMUR News 9.
Spend quality time this summer with family and friends in a relaxing and rejuvenating space where everyone can
Waterlogged crops sit behind Peters' farm stand in Salem. This month has been one lifelong farmer John Peters would like to forget.
I would say it's probably 20% of the crop's been wiped out.
More than 11 inches of rain have soaked fields and farms here in Salem, and all this rain coming far too late in the season.
It's too late to replant. We've seen this in April and May and even into June, and usually it's early enough to replant at that stage, but once you get into July, it's just too late to replant.
Thomas Smith is facing the same issue. Too much rain is damaging parts of the 25-acre Smith farm in Hudson. His farm stand is fully stocked and business is good right now, but the fall could be a different story.
We have late land plantings that we would be doing right now that you can't even walk on them, never mind drive a tractor on them.
Crops like late-season corn and summer squash, cucumbers, and pumpkins are all smaller and suffering from all the rain. But not all hope is lost. These farmers say a change in the weather could turn things around quickly.
If the weather stops and we start getting drier times, everything's going to work out pretty good. Right now, we pick what we can, and we still got a show going on.
I think it's going to be a shorter season. Most years we can go up to Columbus Day, and this year I don't think it's going to go that far. Probably like maybe mid-September or so.
So if you want those fresh fruits and vegetables, you want to get them early. Both of these farmers say this is really tough, especially coming off such a dry season like we had last summer. But they agree that too much of something like rain in this case is more damaging. We're live in Salem. I'm Nicole Lally, WMUR News.
Okay, and there you go on that video and that report. Man accused in Salem crash told police he had 4 drinks, court documents say. Let's take a listen to that video from WMUR News 9.
My old roof was an asphalt roof. It was really starting to look ragged. It's an island house. I wanted it to blend in better, so I decided to go with a
We're very excited, and we're feeling like things are starting to get back to normal now, to be back in the house. There's still a lot of work to do, but, I don't even want to be in those rooms anyways at this point.
The rooms are taped off with plastic, empty of all furniture. For Joe Tutroni and his wife, they remain a crime scene. Their little Juliana was nearly killed by a flying granite post, her jaw broken, a vein in her neck severed. But she is one resilient 5-year-old.
She's home. She's doing great. She's really upset because she can't go swimming in the pool. So, she had a little bit of a fit because all, her siblings are going in the pool.
Instead, Juliana got to help Dad cut the grass, and that made her smile. Dr. Scott Dowd lives 9/10 of a mile from here. Court documents say he has no recollection of the crash. The affidavit states Dowd was going in excess of 75 miles per hour and nearly struck a mother walking with her 2 children before crashing. Despite the terror, the Tutronis say they're here to stay. The outpouring of support has brought in nearly $60,000.
This is the place to be. Let's put it that way. This is the place to be. I may put some large boulders over there to kind of put my mind at ease, put my family at ease.
Dr. Scott Dowd set to be arraigned at Rockingham Superior Court in Brentwood August 19th at 1 o'clock. The charging sheet is lengthy and includes 5 felony counts. We're live in Salem this evening. Amy Cavino, WMUR News 9.
Okay, and there you go on that video and that report. Delta variant now accounts for more than 80% of COVID cases. Let's take a listen to that video from CBS News.
Now to other headline, the alarming jump in COVID cases across the U.S. New infections are up by more than 120% nationwide. That's in the past month. And the situation in Florida is reaching a critical point. CBS's Manuel Bojorquez reports tonight from Miami.
Tonight, Florida is preparing for the worst as cases of the Delta variant surge. And while nowhere near the pandemic highs, a 4th, mostly preventable wave is appearing.
It's frustrating. It's past beyond sadness.
A 111% jump in COVID patients over the last 2 weeks at Miami's Jackson Health System means most hospital visitors will be banned. 95% of patients with the virus being treated here are unvaccinated.
The amount of disease process that they go through is incredible. It's terrible. It's absolutely terrible.
Nurse manager Alex Zaharsky says the patients are coming in younger, and with the Delta variant, they're getting sicker faster.
A very young patient, in her 20s, she has asthma, little history of asthma, did not get vaccinated, and she ended up passing away.
She died.
Only lasted maybe 12 days.
It's not just South Florida. The state as a whole accounts for nearly 20% of the nation's new cases over the last week. Nationwide, while vaccination rates have plunged since the middle of April, the more contagious Delta variant has gained a foothold, rising exponentially. Today on Capitol Hill, the CDC director put it bluntly.
The Delta variant now represents 83% of sequenced cases.
In that same hearing, an exchange between Senator Rand Paul and Dr. Anthony Fauci over the virus's origins went like this.
Because you're trying to obscure responsibility for 4 million people dying around the world from a pandemic.
I totally resent the lie that you are now propagating. And if anybody is lying here, Senator, it is you.
Still, the biggest battle against COVID remains on the front lines.
I know that you hope these numbers will start to go down.
I do.
But do you think they will?
I truly, honestly, I know in my heart they won't.
Tonight, a new lab study found the Johnson & Johnson vaccine elicited lower levels of protective antibodies against the Delta variant compared to the Pfizer or Moderna vaccine. But it's unclear whether the shot still provides enough protection in people or whether a booster may be needed. Nora?
Manny Bojorquez, thank you so much.
Okay, and there you go on that video and that report. And that does it for this morning edition of the Riley King Newscast right here on the Riley King Network. I hope you all have a great rest of your day. Thank you for watching. Goodbye.